I like that tip, flipping the script. They pay you. I'm keeping that one in mind. All right, I have Scott Allen here from Satori Health. Fascinating to talk to. We're talking about treating depression using ketamine. So if our viewers don't know what that is, what exactly is ketamine?
So ketamine is an anesthesia medication. I'm an anesthesiologist, and we've been using it safely in the operating room for many years. In fact, we use it a lot in obstetric anesthesia when we're doing C-sections, so we've been using it for a long time. But about 20 years ago, researchers started looking at it for treating depression, PTSD, anxiety, and about 5 years ago, it started getting popularized as a mainstream treatment.
Now, who is this for? Is this for somebody who has maybe exhausted all other options and they're looking for something new?
Yeah. So the typical patient, has struggled with depression or anxiety or PTSD for many years. They've tried several different medications, they've tried therapy, but it doesn't seem to be getting them where they want to get. But we are starting to see more people who are coming to see us earlier in their disease process. So maybe somebody who's only had depression for a short period of time is trying to get a handle on it. They don't want to be on antidepressant medications. So it might be a good early option for them.
Now, what's truly amazing to talk about is the ethics of the treatment at Satori. Tell me about the experience.
Yeah, so we're seeing a lot of different ketamine clinics pop up, and people who are exploring ketamine as an option for depression, we just like to let them be aware of the different ways of doing it. So ketamine tends to be a very visionary experience. You go in there, you get the medicine, it puts you into an altered state of consciousness. In there, you confront a lot of the things that you're dealing with. So maybe you've had trauma in the past. You confront some of this trauma, depression, bad relationships. Things that you've been holding on to for many years tend to be released. And so our philosophy is that we never leave you alone during the treatment. We want to be there as a support before, during, and after the therapy. Because when those difficult emotions come up, you need a mechanism to help safely process them.
Well, sure, you go in and you're not in the greatest space mentally and emotionally, so to be left up to your own devices and maybe not know how you'd respond or react to the medication sounds scary, but knowing that at Satori you are there one-on-one, you take a smaller number in so that you can really do that personal focus.
Yeah, so my wife Rachel and I, we're both anesthesiologists. We've kind of made the decision to keep the clinic a little bit smaller so that we can develop more meaningful relationships with patients. We feel like, kind of ethically, if you're going to be doing it, you want to spend more time with people. You want to dig into the root of their issues. You want to be able to develop that therapeutic relationship, because one, you'll probably need fewer ketamine treatments. It'll be less expensive for you. And also it's better for us because we really enjoy those deep, meaningful relationships that we cultivate with patients over time.
Talk to us about what happens after something called integration.
Yeah, so we've developed this process, it's called integration. So when you get ketamine, you have these unconscious experiences that get brought to your conscious mind. These experiences tend to be very meaningful, but oftentimes they're kind of difficult to process. So through the integration process, you can kind of think of it sort of like group therapy or individual one-on-one therapy, but you take those visionary experiences, you integrate them into your lives, and that can lead to transformative change.
What kind of feedback are you hearing from patients?
Oh man, patients, they're just loving it. They say it's changed their lives. People who used to be suicidal aren't suicidal anymore. They really appreciate the in-depth process that we take with them. We tend to get a lot of people who have had a lot of sexual trauma in the past. Those patients need a lot of care and concern because of the sensitive nature of what's been going on.
Well, I love that you are all about sending that individual out with the right tools and really having processed their trauma to succeed. I love what you're doing. If people want to learn more, where can they go?
So we have a website. It's stgeorgeketamine.com. Just search stgeorgeketamine.com or Satori. Satori actually means sudden enlightenment or getting into the flow state. So we feel like that's what we're doing. The patients are getting into the flow, providers are getting into the flow. It's a very holistic, organic process of deep, meaningful change.
I love how you've described it, and I love your approach. You have the information there. Scott, thank you so much for stopping by.
Yes, thank you for having me.
Okay, Brian, what's up there in Salt Lake? What do you have coming up next?
Well, we're working out. It's a Fitness Friday, right? And today's trainer shares the do's and don'ts of working out when you're pregnant. Keep it right here. GTU returns live after this.